we're going again. And I'm so happy that hopefully more people can join. I mean, Friday, take the day off and just like listen to a Substack live, right?
Yeah.
And yeah, so I'm with Priya Bathija. I'm going to do a quick intro to me in case anyone is coming this way via Priya and Women's Health Playbook. So I'm Molly Dickens with Internal Stress Project. And Maternal Stress Project is really putting together sort of this broader view on stress and women's health and how we better identify stressors across a woman's lifespan, so that we can find more effective opportunities to reduce that stress and improve health. And key to this goal is this sort of insane looking stressor map. Maybe you're familiar, maybe you're not. Don't look at it now. Your eyes may start bleeding. But I'm going to have a link to it in the recording of this to share out. And on that stressor map, like right up top, is healthcare access and experience and how interconnected it is with other stressors that women will encounter. And obviously, limited healthcare access is a physical stressor. I mean, has a physical effect if you can't get the care you need, if you can't find the doctor that you need. That will have repercussions on your health directly. But what we're really talking about when it comes to stress, and especially this conversation, is what it means to have that experience, to feel feel that feeling of not having the access, to feel like you're not being heard, to feel all the things of kind of these psychological stressors that are associated with healthcare access and experience. And especially because they're less appreciated and a little bit ironic in that, we know that stress affects health, and yet seeking healthcare can be stressful. So this is why Priya is here to have this conversation with me. Priya has spent, most of your career in the healthcare space, and I'm going to let you do a much better intro than I will be able to do. But Priya is the founder of the women's health company New Health. She recently launched the full first season of her podcast, the Women's Health Playbook. And, a lot of what I talk about at Internal Stress Project and what we'll kind of get into here is how, often when we think about exposure to stressors, a lot of exposure to stressors are unavoidable, especially when it comes to healthcare access and experience, right? And so the stress reduction really comes in when you have more of this, how are you perceiving that as a stressor, how you have a sense of control, how you have some predictability, how you have some sense of agency, right? And that's what the Women's Health Playbook is offering, and what it's delivering. It's education, it's awareness, it is agency in its own way, right? And so that was a big tee up. I'm going to kick it to Priya. She's going to just do a quick hello, I'm Priya, and fill in all the gaps that I missed. And also, I'd love to hear, Priya, how you kind of break down. There's 6 episodes in the first season. They're they're wonderful. They're easy to listen to. They're 30 minutes each. It's just like chock full of information packed into like a really tight package. And so I would love to hear you kind of walk us through Women's Health Playbook a bit too. So
Yeah, great.
yeah.
Well, Molly, I am so excited to be here and to, I apologize for those of you that listened and the tech issues kept us from moving forward on Wednesday. Hopefully today will go better. It already seems to be going better. But a little bit about me, I started my career as a health law attorney. I worked for hospitals and health systems. I then moved into the policy space and spent 9 years at the American Hospital Association, working on healthcare payment policy, rural hospital issues. I got the opportunity to start a think tank that looked at healthcare costs and affordability, to lead efforts on maternal health, social determinants of health, vaccine confidence, a variety of different issues over the 9 years that I was at the American Hospital Association, and really got a sense of what's happening in healthcare and how it is not only impacting hospitals, but the patients and communities that they serve. I left the American Hospital Association 4 years ago to start my own company, New Health, that Molly mentioned. And through that company, it's had several evolutions, I guess you could say. But now we are focused primarily on helping hospitals and health systems navigate women's health. So helping them see what the full expansive definition of women's health is,
Mhm.
helping them understand different best practices, different programs they can implement, and really just getting them to assess what's happening in their communities and with their patients and provide women with the care that they actually need when they need it across their entire lifetime. I launched the Women's Health Playbook in May to fill a gap I was seeing. So I love the work that I'm doing with healthcare organizations, but I continually saw this knowledge gap that women
Mhm.
have. And there are a lot of really great podcasts and books and television shows now that are sort of closing that knowledge gap around different conditions in women's health, right? So we've got more conversation on menopause, more conversation on endometriosis than we've ever had before.
Mhm.
Continual conversation on maternal health, menstruation. So we're seeing that happen, but what we aren't really seeing is conversation around what does that mean to actually navigate and
Yeah.
access healthcare you need across your life. So we know that women have certain challenges in the healthcare system that are unique to them. Like we have, women's health is under researched, underfunded, misunderstood, and
Underappreciated.
yes, and we know that women spend more time in poor health than men. These are
Mhm.
all
Yeah.
facts that we know. But then how do we change the systems to get better outcomes and experiences for women? And then how do we give women the tools to navigate the system that exists today until we can change it to
Yeah.
something better? And that's what we're trying to do with the Women's Health Playbook. So the first season is a breakdown or a deconstruction of a doctor's visit. So the first episode is, how do you find a doctor? What
Mhm.
are some tips? Where can you look for a doctor? What's the best place to get a referral? We talk about questions that you can ask your doctor to make sure that they're going to align with what you need. The second episode is focused on, how do you prepare for that doctor's appointment? How do you gather your family history, your past medical records, your list of medications? How do you map out the symptoms that you're having? And how do you describe those in a way that the doctor will understand and be able to then decide a course of action?
Mhm.
The third episode is about the legal forms that you fill out when you show
Yeah.
up at a doctor's visit. I mean, I'm a lawyer. I should know those, but I learned so much in that episode. Like
Yeah.
there's so much in those forms, and most of us don't read them.
Yeah.
It is helpful to know what we're signing. Episode 4 is the actual visit. How do
Mhm.
you talk with your clinician? How do you go through the agenda and prep work that you've brought in? What are the benefits of bringing a friend or an advocate with you? And then episode 5 is, what do you do in follow up? What comes after the visit? And we sort of take a two path approach in that episode. The first is, everything goes right. What do you do to get the follow-up care that you need and take
Mhm.
action on the plan you came up with your doctor? And if it doesn't go well, what do you do? What do you do if you
Yeah.
haven't felt heard or respected, or like you got the information that you needed in that first appointment? And then the last episode deconstructs the bill and makes sense of co-pays, EOBs, everything that comes at you after the visit that oftentimes causes us more stress than the visit
Yeah.
itself.
And we'll get into that for
Yeah.
sure. Um, and so like when I was teeing this up, with thinking through the stressor map, and yes, I know I use my hands wildly, so hopefully it's not too distracting for everybody, because I'm like, "The stressor map, blah, 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 blah," and you're like, "I don't know what you're talking
I
about,"
mean, it's
but
a big map, Molly. It's a
it's
big
a
map.
big map and it's very confusing, and there's lots of hand waving. And like I said, healthcare access and experience, it's a pretty broad stressor node, and it kind of, the way that I have it looks like it kinda clumps up, especially for, the perinatal period, fertility, pregnancy, birth, postpartum, and then there's kind of another clump, and it's connected, so it's kind of,
Yeah.
I'm trying to describe it, but I don't know, visualize if you can. Later, there's another clump around, like, perimenopause and menopause care. And, listening into the podcast, I was like, it really, like, it is important to just kind of see that it's not just those
Mhm.
chunks of time. It's the whole package. It's the whole time we're seeking care. We have bodies that are, in the in between, and we have needs in the in between. And is it right to assume that it's highest during those times, or would you say it's pretty even across? And like, what are the ways, maybe this is a two-part question, but what are the ways that healthcare access really does come up for women as a stressor in how you've seen it in your work and your conversations?
Yeah, so I think you're right. Sort of the two concentrations of the main, like, stressors come when we spend more time in the healthcare
Yeah.
system, right? So,
Yeah.
a lot of times for women, their first real entry point is pregnancy, right? I don't think
Mhm.
that's the right first entry point. There are a
Yeah.
lot of places that we could be engaging with women and making sure their health was better prior to pregnancy. Um, but that's where most women engage. So that is a stressor. And then menopause is a stressor, and it's sort of a bit of a different stressor. Like there's more
Mhm.
conversation around menopause now, but I think the stress that comes in the perimenopause period is like you aren't able to get the care that you need. Like only 20 to 30% of OBGYNs are trained in perimenopause and menopause, and other specialties, the rate is even less. So what
Yeah.
happens there in terms of stress and access is women aren't able to get the right clinical help and support
Mhm.
for that phase of life. So it's a bit different at both, but then
Yeah.
there are a lot of other points where stress sort of picks up, and they make sense, right? You get a sudden diagnosis of breast or ovarian cancer, right? It's
Yeah.
gonna pick up.
Yeah. Yeah.
Um,
Yeah.
you're living with chronic conditions like diabetes, heart disease, migraines, autoimmune conditions, and mental health conditions, and all of those impact women differently or disproportionately,
Mhm.
right? So
Mhm.
that stress is gonna be higher for women
Yeah.
dealing with those conditions. Or if you're simply just struggling to get a diagnosis, we talked about sort of
Mm.
the care
Mhm.
gap around menopause, but think about the average woman takes 7 to 10 years to get a diagnosis on endometriosis, and I
Yeah.
think you shared the study that just came out, Molly, that showed,
Yeah.
like, once women get that diagnosis, the most common feeling they have is grief, and I shared
Relief. It's relief.
relief, sorry, relief.
Relief.
Yes,
Yeah.
relief,
Which is,
sorry.
like, mind-blowing.
Oof.
It's like I think it
Mm.
was 87% of women
Yeah,
report feeling relief. And then on the other side, like, because they're looking at all kinds of
yeah,
emotions, 32% express anger, report that
yeah,
they feel only 32% feel angry about about it.
yeah. No, and the
87% feel relieved. Like,
that
that says
feeling of
a lot.
relief, I'm not so sure why the word grief came out, but relief.
Yeah, it rhymes.
I We shouldn't have needed a study to show us that,
I
but
know,
now
right?
we have
Yeah,
it,
it's
like,
true,
we
it's true.
have it,
Yeah,
and we have that knowledge, and we understand, but that's another place where stress
yeah,
comes up when
yeah,
you're
yeah,
constantly trying to engage in a healthcare system
yeah,
with clinicians that don't have the research and the training to
yeah,
address the conditions that you are showing up with.
yeah,
That's a stressor, and
yeah,
to get through 7 to 10 years of that and finally feel like you have an answer, you've been
yeah.
listened to, you've been heard. I mean, I can't even imagine sort of the calm that can come with that despite still having
I
that
know.
condition and still having
Yeah,
to deal with it, but,
yeah, yeah,
sometimes just knowing what it is
yeah,
gives you the ability to pause and say, "Okay, now here's the
yeah.
plan of action, here's how we're moving
Yeah,
forward."
yeah, it's that, feeling seen. It's the
Yeah.
value of feeling seen. And, I think this kind of goes into something we got into in our failed live on Wednesday, but thinking through even the difference or the overlap, I guess, between access and experience, healthcare access and healthcare experience. And often when we think about access, it's the physical, it's the transportation, it's the financial issues that whether or not you can even afford the care that you need. Like that is often what we think about with access. But then, of course, there's less visible barriers to access that women are specifically facing. And, you bring up one, which is just training in women's health issues.
Mhm.
What else have you seen come up in terms of kind of the less visible access
Yeah.
issues?
So Deloitte did a study a while back, which I think is really sets up a nice conversation. They found that women are 35% more likely to skip or delay care. And the
Mhm.
top reasons that they were skipping were what you just covered, affordability, right? 21% of women decided not to see a doctor because the cost was too high. And that number had grown significantly since the previous time that Deloitte
Yeah.
had done this study. Access, so things like transportation, long wait times, not able to get time off of work, or they're busy managing kids' schedules.
Childcare.
Yeah, childcare. Um, but interestingly, the third area was prior experience, right?
Mm,
So were they shaped by something that happened in a previous interaction with a healthcare provider? So did they
yeah.
come into a healthcare provider, they weren't listened to, they weren't heard, they didn't feel like they had the time or that they were respected or they felt like they had a safe environment to share? All of that will impact how they access and
Mhm.
experience healthcare in the future. So I'll give
Yeah.
you an example for myself, right? I'm educated. I've been in healthcare for 23 years. My parents are doctors. It's been all around me my whole life, right? But I struggled for 13 years to find a good endocrinologist. I
Mhm.
struggled to find someone who would actually sit down, listen to me, talk about my concerns, talk about my past blood work, and actually make a plan for how we're going to manage my conditions going forward.
Yeah.
And I've had horrible experiences with
Yeah.
primary care doctors and OBGYNs. And I think we all have had those experiences, and
Yeah.
2 things I would say is, like, we do carry them in ourselves when we show up
Mhm.
next time with a doctor. Like, when you've had a bad experience, the next time you kind of feel like maybe you'll have a bad experience again,
Yeah.
and I think Amanda does a really nice job in episode 4 in saying, like, if you have had a bad experience, when you get in with your next doctor, like, tell them about that.
Yeah.
Explain that
Yeah.
to them so they know where
Yeah.
you're coming from and what you've experienced. And then the second thing I would say is I know a lot of doctors, like
Yeah.
a lot of doctors. And I know a lot of really, really good doctors who got into
Yeah.
medicine because they wanted to help people. And as Amanda says in episode 4, doctors aren't evil, right? They are
Yeah.
there for the right reasons. And they have their own pressures and they have their
Yeah.
own stressors that they are working within from the system. And
Yeah.
so I think, we have great conversations in episodes 4 and 5 about how do you come at this conversation in a way that takes into account the stressors that they are facing as care teams, but how do you also make them aware of the stressors you've faced as a patient?
Yeah. And I think that's a really important point. And I'm clearly a very visual learner, as you can see from the insane map. But the idea that there's a circular aspect to this, that experience flavors access, access probably flavors experience,
Mhm.
and like round and round it goes. And maybe the crux of it is really how trust is established or trust is broken, and then that feeds back in. And
Yeah,
so, one of the things that you had just pointed out is that some of this, whether it's miscommunication, whether it's how it flavors the experience, whether how it flavors the trust on both sides, um, could be pain points that are just reflective of kind of a broken system. So
yeah.
we're in America, we're talking about the American healthcare system. That's what we're familiar with in terms of the different levels of how it can be broken. Um, and so how much of these pain points are reflective of just existing in the system that we exist in today?
Oh, yeah. I mean, I think our system
We don't have
is
to spend too much time in it, but
yeah,
yes.
it's broken in a lot of ways. It's broken in how we are paying for the care that is delivered. Like, we are largely paying for sick care instead of well care. And so when you have a system that is set up that to run a business within, people have to be sick and not healthy, that is not necessarily going to lead to the best outcomes for
Mhm,
individuals, right?
mhm.
We also just have so much administrative process and paperwork around healthcare. And that's not just from a patient perspective, right? Like you go to one doctor's appointment and how many things do you get in the mail in response, right? You get your bill, you get your EOB, you get your statement for anything that wasn't covered because you didn't pay it immediately in 15 days. You start getting those things coming in.
Yeah.
There's just a lot of administrative paperwork associated with billing for healthcare, for documentation of what doctors need to produce about your care and the conversations they have with you in the
Yeah.
exam room. There's a lot of, I'll just use the word dysfunction in how we actually set up appointments, how we do scheduling for
Yeah.
appointments. And in the sample questions you gave me before this, you said, like, what is the real problem? And I think the real problem is we never designed our healthcare system with the actual patient in mind,
Mm,
right? And think about that. Like,
yeah.
if you think
Yeah.
about,
Start over,
yeah,
everybody.
I mean, I
Start
think
over.
we have to like blow it up and start all over again. But I mean, think about
Yeah.
like clinical research, right? There's so
Yeah.
many reasons why women weren't included before
Yeah.
1993, but
Well,
one of them was simply it's easier to do a study without the hormones, right? Like,
I mean, it's th- it's not a total truth, but that was the assumption.
yeah,
Scientists had it
it's
locked in their
the
brains
assumption.
that hormones are trouble. We
Yes,
can't study anything with cycling hormones. But yes,
yeah.
and also
But
just
like,
myth bust.
look at how doctors' appointments are scheduled. I mean,
Yeah.
if they were
I mean, it's
truly
all
built
built around a male system, right?
right, and if it was built
Yeah.
around the patient, we'd see a lot
Yeah.
more appointments after work hours, on
Mm,
weekends. Like,
yeah.
there would
Yeah.
things would be different if we actually structured them around the patient. We'd
Yeah.
have a lot more time for conversation. We'd have
Yeah.
a lot more time to think about all of the factors that happen in a person's life outside of healthcare, so those
Yeah.
social determinants of health. So, I think fundamentally, when you say, "How is it broken? Why is it broken?" My response is, I think we haven't built it around the right person.
Yeah. Yeah. Going back to the point you made about endometriosis, especially like as an example for a
Mhm.
diagnosis that takes far too long for something that is extremely painful, and something that is very female body specific, right? And when we think about just more people are kind of, I don't know, using the term or acknowledging the term medical gaslighting and how that exists as a stressor more around, are women more likely to be dismissed as patients, or women's health conditions just more easy to dismiss because they're less understood, they're harder to diagnose, there's less people who are specialized? Just a quick, I mean, I have further thoughts on this, but I don't know, do you think it's just a women's condition thing or just that the specialties don't always align with what we need?
I mean, I think it's both, right?
Yeah.
And I think it would be hard to pinpoint it on one or the other. But I do think for those of you who are on and may not have read, I do think Anousheh Hossain's book, The Pain Gap,
Mm,
How Sexism and Racism Kill Women, is a really interesting book to read. I include it on my must read list for people who are interested in women's health because she does talk about the misogyny and the sexism and the racism that exist in our society and the impact that that has on healthcare. So I think
mhm.
that is a large piece. Like we have example after example where care teams choose to not listen to women. Like,
Yeah,
they actively choose to not listen to women of color, right?
yeah,
And I think she says so nicely in that book, like, when things are bad for women, they're worse for women of color, and they're the worst for Black women, and I
yeah,
think
yeah.
we see that just as
And
a
health
baseline.
disparities, like,
Yes.
then that shows up in health disparities, and we're like, "Oh, it must be
Yeah.
race-based," and you're like, "No, no,
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 no."
so many reasons. But I
Yeah,
also think we can't discount the fact that we don't have enough research on
yeah,
conditions that are impacting women differently or
yeah,
disproportionately. We can't
yeah,
discount the fact that we still don't have enough women in clinical research.
yeah,
Like, it's
yeah,
not just that
yeah,
we haven't studied the conditions that impact us differently and disproportionately. We just also don't have enough women, and we're not doing enough analysis or sex-based variation studies, right? To look at
Yeah.
how things are happening differently in women. And we know in some areas that's very clear, right? In
Yeah.
how
Yeah.
women, for example, show up with symptoms of a heart attack. They can be
Yeah.
different. Yes, the main symptom is still chest pain, but women can also have what they call atypical symptoms of like nausea, jaw pain, back
Yeah.
pain. And we know from research that when women show up with those conditions in an emergency department, they are more likely to be dismissed, sent home,
Yeah.
not
Yeah.
given the tests that they need. And so we don't have enough research. The
Yeah.
research we have hasn't been disseminated appropriately in training
Mhm.
and education. And so I feel like sometimes when we have this conversation about medical gaslighting, a lot of doctors take the shaft on it, and
Yeah.
we weren't necessarily set up for success. Like, even
Yeah.
now, if they
That's
want
a good point.
if they wanna get this education, they have to go out on their own and find it.
Mhm. Mhm.
And yes, there are
Yeah.
more doctor influencers that are making that education more available, but it's still, like, on their own time, on their own
Yes.
dime,
It's
trying
not
to
part of
figure it out.
medical school curriculum. Yeah.
Right. Like,
Yeah.
I mean, I was talking to my sister the other day, and she's a physician, and she was talking about, like, how much training do OBGYNs get on all the primary care
Yeah.
conditions, all the
Yeah.
endocrine conditions, all the hormonal conditions,
Oh,
like,
yeah.
how much do
Yeah.
they actually get in their training? Not very much,
Yeah.
but we as a healthcare system and we as individual women have come to rely on them to do everything. And
Yeah.
they're not
Yes.
trained to do
Yeah.
everything, and
Yeah.
imagine how you would feel as a doctor being asked to do everything when you
Yeah.
haven't been trained on it.
Yeah. Yeah. No, that's such a good point. Um, and then so to transition this into some of like the meat of the podcast,
Mhm,
one of the things that where I would see this come up is how to advocate for yourself or how to find the right advocate for yourself in these moments. And so this is like episode 4, right? When you were
yep,
talking to Amanda. Because I mean, I find myself doing this. Like, so I'm a physiologist by training. I don't have a medical background, but I know the human body. And in some cases, I feel like I've studied basic
mhm,
physiology even more than some people. And I still find myself going into good patient mode where I'm like, just tell me. Just I don't want to really discuss too many things. Like,
mhm,
just what do I do? So we go into good patient mode. Like I've seen this. My mom is going through she's going through early dementia right now, and so we're in doctor's appointments, and she's still very much with it. She was a nurse. She was an emergency room nurse. She is a trained medical
mhm,
professional. And she just goes into good patient mode. And maybe this is a little bit of dementia too, but like, so I'm in the room and I'm the one who's like, no, like,
yeah,
let's talk about these things. And she's like, it's okay. It's okay. It's all okay. I'm like, stop going into good patient mode. But
yeah,
I feel like we do that. Like we go, so it's almost more important to have someone there to remind you that these are the things you would fight for if you were the advocate for someone else, you know?
yes,
So how
absolutely,
do we either realize this about ourselves that we're terrible and advocating for ourselves, or that maybe we are advocating for ourselves? So how do we prepare for it? Or how do we find the person that can be that for us and just
yeah,
be our voice in that room so that if we go into good patient mode, we can still walk out of those appointments being like, oh, okay, I don't
yeah,
regret not saying anything, right?
yeah, and
What
I
does that look
think,
like?
we're so trained as women to want to be good, want to
Mhm.
be nice, want to
Yeah.
be accommodating, right? And when you add in healthcare, like, we have been trained to defer to our clinicians, right? So when we show up, they are the ones with the knowledge. We're there to like soak it out of them, right? And
Yeah.
so we tend to think that being good, being a people pleaser is going to get us the best chance we have of getting good healthcare, right? And that's not really accurate. And I think both Kelly Greening and Amanda Burke in the first season, do a nice job of setting forth like 3 things that women should remember when they are in the doctor's
Mhm.
appointment, right? And the first is that you're paying for this time. You've gotta take up space in that
Yeah.
room. And the second is, like, you're there to build a relationship. You're there to ask questions. You're there to be prepared as a patient and come in with that. And to if you can't do that or don't feel comfortable there, you have the right to bring in a friend
Yeah.
or an advocate
Yeah.
with you. So first, it's your time. You're paying for it. Take up space. Second, like bring an advocate, bring a
Mhm.
friend, bring someone who can help you navigate that. And then the third piece, and this one's from Kelly, is like, asking questions doesn't make you a difficult patient, it
Yeah.
makes you a good patient, right?
Yeah.
Being prepared to actually carry your own weight in this appointment is really something I think that we don't get taught, and I think the
Yeah.
podcast does a nice
Yeah.
job of laying out what does it mean to be prepared when you walk into that room so that you have the best chance of success in getting what you need in that conversation. And I will tell you, I've talked to so many women who have listened to the podcast before going into a doctor's appointment, and they talk about how great it went. And I do think that doctors want prepared patients. It's in
Yeah.
everyone's best
Yeah.
interest to be able to say, like, for a doctor to see that a patient understands their medical history, they understand the past lab works and tests that they've gotten. And we're starting here in the conversation.
Yeah.
We're not
Yeah.
starting at ground zero because, again, remember, we're on a clock. Every
Yeah.
appointment is 15 to 20 minutes. And so if a patient comes in prepared, you start at a much better starting point to get to what you need to accomplish in that visit.
Yeah. Yeah. And I mean, also, probably if you go in feeling like you will be listened to,
Mhm,
um, and having, you know, acknowledging that you are the keeper of your body's secrets.
mhm.
You have information about yourself that your doctor doesn't have. And if you don't bring that information up, they're working with
Yeah.
a limited set of data, right? So, I mean, how much of that is just like, just
Well,
coming in with, I don't know, an assumption around
yeah. No, I mean,
trust.
I think we should come in prepared. I think we should
Yeah,
come in with an assumption that our doctor's gonna be on our side. They're gonna
yeah,
be our
yeah,
partner in getting to a better healthcare future, right? That's in
yeah,
everyone's best interest. But I think it's really important for women to understand that they are the expert in their body, as you
yeah,
said, but
yeah,
also they're their expert in their own lived experience, right?
yeah.
No one else has lived in that body or had that experience except for you. And you have to be confident in explaining that to your care team. Don't
Mhm.
shy away or don't assume it didn't happen because you feel a little uncomfortable in that conversation, right? You are the expert. And I think when you go in with that confidence, it leads to a better outcome too,
Yeah,
and I'm not talking about, like, an arrogance, I'm talking about a security. You're
mhm,
secure in all the documentation you've brought in, you're secure in what has happened, you're able to say, "In the past, my doctors haven't listened to me. I would really love if we could talk about A, B, C, and D." I
yeah,
think that changes the tenor and the equation in a doctor's appointment. Now, you may still have a doctor that is having a bad day. You may have
yeah,
a doctor that is running late from the last patient, needs to be on time for the next patient, and you get less time. You may have a doctor who doesn't have the education on the condition that you're seeking. There could be a lot of different factors, but I think if you want to set yourself up for the
yeah,
best possible outcome, do these things.
yeah, yeah, and that kind of plays into when I think about when we talk about, like, stress reduction, like, what it looks like to have tools for stress reduction. I go back to the basics of what our how our brain is kind of activating
Mhm.
that response. And often it comes into that sort of that feeling of lack of control, that feeling of unpredictability. And so the flip of that is a sense of control and a sense
Yes.
of predictability, and not like tight control, like that's why agency maybe is a
Yeah.
better word than control. Um, and so when we think about how that applies to the healthcare journey and how it applies to the work you're doing, one of the things I really appreciate about the playbook is that it's very clear, like, this is education. This is awareness. This is giving you, and we talked about it in the last, our failed live on Wednesday, just literacy, like healthcare
Yeah.
literacy, what it means to have this in your toolkit when you're navigating, again, a broken system, all the difficulties, the way that, just inevitable things you might encounter along the way. To have these in your toolkit can be really valuable. So, what does it actually look like in your dream world, or through, someone has really taken all the key things that you provided in Women's Health Playbook? What does it look like for a woman, especially, to feel in control or to feel that sense of agency in her healthcare journey?
Well, and I think, you talked about health literacy, and we dived into it a little bit on the failed live on Wednesday, but, just to reiterate for those that weren't here or missed it, like, only 12% of Americans are health literate. That means that 88% of US adults have difficulty navigating, understanding, and making informed decisions about their healthcare. So, when I was thinking about where do we fill a gap, where do we create a new podcast, I came across that statistic as I was looking up what are the most commonly Googled questions by women
Mhm.
about their health, right? And when you put what women are looking for information on together with this fact that 88% of our country isn't able to make healthcare decisions because of a lack of knowledge or this knowledge gap that we talk
Yeah.
about in women's health, um, that's where I knew, like, we've gotta give women the tools they need to understand the healthcare system,
Yeah.
to understand, like, the little things, the not sexy things, the copays, the deductibles, the what does it mean if you wanna ask for a second doctor's appointment because you didn't have enough time in the first appointment. So I think the toolkit is filled with resources, like the Women's Health
Mhm.
Playbook podcast, great, that's one resource, but there's so many other resources, and we're gonna be using our Substack going forward. It's only, like, 1 week old, so going forward to, like, build upon those resources that exist.
Yeah.
Like, I've been talking a lot lately with women who are about to turn 65 or have just turned 65, and they are sort of making all the decisions around traditional Medicare, Medicare Advantage. They're
Mm.
trying to figure out Part D plans. They're trying to understand sort of what is Medicare, right?
Mhm.
Well, there's a really great guide that has been put together by the Society of Women's Health Research and Healthy Women that walk through every decision point associated with a woman turning 65 and having
Yeah.
to make those decisions. And a lot of women are concerned about which plans to choose. And one thing they're not thinking about is what happens to women uniquely as they age and how is that accounting for in the Medicare program. And so this guide doesn't just talk about how to pick, it talks about what happens to women's bone health, what happens to our heart health, what happens to our brain health as we are 65 and beyond, and what do we need to be looking for in the Medicare program to make sure that we can access the things that we need. And
Mhm.
so there's all these great resources out there, and I think pulling all those together in one place and having sort of a library or encyclopedia for women to say, okay, I've got to make this decision. I can go to this toolkit and I can find what I need. And then I can get confident that I have the knowledge gap filled. And I
Yeah.
can go in with the right questions. I can make the right decisions. I can be literate in what I need to address, right? And
Yeah.
same if it's for your kid. I often say and, you
Well,
know
yeah, this is the other thing, right?
yeah,
It's like women, especially when you think about sandwich generation
Yeah.
women, healthcare access and experience expands to navigating healthcare access and their experience with it for their children, but also navigating that for aging parents, especially aging mothers, because doubled
Yes.
down with all the women's health issues. And
Yes. And
yeah,
I think there are times where women would have no qualms
yeah,
about doing the research or getting prepared for a doctor's appointment for their kid or their parent, but they will just Hail Mary pass it for their own.
yeah,
Or they
yes,
will, like, they'll
yes,
research everything, they'll do everything right, and then when it comes to their own health, so, I feel like that one of the answers is take care of yourself the way that you would take care of your kid or your parent or your spouse, right? And that's easy for me to just sit here and say, but I
yeah,
can tell you, like, I had a doctor's appointment last month and I even wrote a post about it on LinkedIn because it was such a fabulous appointment. And
yeah,
I think it was fabulous for two reasons. It was fabulous because I prepared. And I prepared following the rules that all the speakers in the first season shared because I had never done that before
yeah,
for a
yeah,
doctor's appointment.
yeah,
And then I had a really great doctor who wanted to talk through everything and
yeah,
was willing to sit down, listen. We had real shared decision making, and it was fantastic.
yeah,
And when healthcare goes right in our country, it is so beautiful.
yeah,
And so this toolkit would allow women to do their work, but
yeah.
it's also intended to be a guide for clinicians, right? Who want to
Hmm.
help their patients prepare so that they can have better engagement with them. So
Yeah,
imagine
yeah,
someday if doctors around the country say, listen to episodes 1 through 6
yeah,
of the
yes.
Women's Health Playbook, prepare,
Before your appointment. This is
come in,
yes,
and we're
yes.
going to have a great
Come in, we're
conversation,
good.
right?
Yeah, yeah, yeah. And I'm like, Molly is making a note to schedule her appointment with her doctor. Um, so, you know, one of the things that I love about Women's Health Playbook, it is this very here is what to do. Like it's a playbook. It is a playbook. Um, and of course, we also need to think about what it looks like for those who are kind of excluded.
Mhm.
Maybe excluded is not the right word, but overburdened by a system, whether it's, the paperwork is not in their native language or whether it's their Medicaid and their access is limited with who they can see and how they can see them, or maybe they have to fill out all the paperwork because of work requirements. That's a whole
Yeah.
other thing we're not going to go through. But essentially, when does or where does individual strategy end and systemic change need to begin?
I
If
think it all
that's if that's not a too big of a question to throw at you at minute 45.
yeah, I mean, it's a big question, Molly, and I think you need both of them working
Yeah,
simultaneously together because it is going to, if we can get the political wherewithal we need
yeah,
to actually change how we deliver and pay for healthcare in our country, which realistically, I'm not sure I see happening anytime soon.
yeah,
But we all, as advocates, need to continue fighting for that, right? We need to continue saying this is the best way to deliver care. These are the evidence based best practices. These are things we know work. These are things that we should be promoting, not just in how we deliver care, but in the payment systems and structures that surround that care delivery. We've got to keep moving. And part of that movement is the education of policymakers and decision makers in organizations to keep that moving. But as that's happening, we can't lose sight of our own agency
yeah,
and our own ability to strategize how we work within the rules that we have right now. So I think they have to both be
yeah,
moving at the
yeah,
same time. And then when we can see policy change, when we can see things like Medicaid coverage is now available 1 year postpartum, that was a huge change
yeah.
that took
Way too long.
decades to
Way too
get
long.
over the advocacy finish line,
Yeah,
but
yeah,
now women can maybe say, "Okay, the rules have changed a little bit, but I still need to do A, B, C, and D as I prepare
Yeah.
for my
Yeah.
pregnancy or my next appointment with my OBGYN or, um, and I just think there's so much work to be done. I often say that like in women's health, everyone can play a role, right? Like we can play a role in like listening to the women in our lives. We can play a role in creating space for them to share their experiences. We can play a role in our workplaces as we're making policies and decisions that impact not just women, but families. We can play a role like in advocating for policy, in voting for candidates that support these positions that would move things the way we want to move them forward. There's so many things that we can do to all be advocates for the future. And I think that, like, when we look at what we want to do for women's health, part of that becomes how do we want to take care of our own health? Because
Hmm.
we're not here in the future because we haven't taken care of our own
Yeah.
health. Like, we can't move it forward for anyone else.
Yeah. 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 No, I really appreciate that point. Um, and to wrap up, let's get like in a dream world for a
Yeah.
second. I of course have like a million other questions that I wanted to ask you, so maybe we'll just have to do this all over again and blame tech. But to wrap up, if you could just wave a magic wand again in a dream world, what are maybe let's go with two, maybe two or
Okay.
three, or I don't know, narrow it down. What are things you might fix about the healthcare system to benefit all women, women's health, and really from this sort of stress reduction perspective?
Yeah. I mean, I would first take on affordability, right? Like
Mhm.
healthcare
Yeah.
costs have been out of control for so long and they continue to increase. I just read an article this week that um, premiums for ACA plans are going to go up again next year in double digit percentages, right? And so this is not sustainable for individuals, for the healthcare system as a whole, and our country. So
And
I think
financial stress is a biggie.
big one.
Yeah.
Huge,
Yeah.
right? And if we know 35% of women are already delaying or skipping care because of
Yeah.
cost, as the
Yeah.
cost continues to increase, that's going to increase. So I think we have to truly address that as a country, not just dance around the edges the way that we
Yeah.
have been. We have to look beyond just coverage. We have to look at like what is that coverage? What
Yeah.
because having insurance doesn't mean we're getting the things that we need from the healthcare system. And then the second thing I would just say is I would love to see everyone actually prioritize women, right?
Yeah.
Women are 51% of the population. They're 80% of the healthcare workforce, and they
Yeah.
birth 100% of our future, right? So
Yeah.
if we're not paying attention to them, I feel like we're missing something
Yeah.
really big. And I think there's enough data now out there that shows that when we actually put women's health first, when we design around women, when we improve their outcomes and experiences, we actually improve healthcare for everyone. And
Yeah.
so I think my dream would be to address affordability and to put sort of the needs of women up front, knowing that that will impact all of the people that they care for as well.
Yeah. And, I think that just harkens back really well to one of the earlier points that you were making was that we're operating in a system that was not built around these bodies and
Mhm.
these bodies' needs. And to rethink how we see and prioritize and consider and just how that even expands out, how that expands into medical school training, how it
Mhm.
expands into specialties, how it expands into how we diagnose and treat and talk and all the things. Like, I think that as a perspective, it could be interesting to think about how the whole system changes when it's just a side shift. It's not like a whole hog, like throw it all out, but yeah,
Yes. And I
yeah,
do think too that like as we engage in healthcare, I think all of us, whether we are a patient, a provider, an
yeah,
advocate, a um, lawyer,
yeah.
researcher, whatever, to sort of come at it with more empathy and grace than we
Mhm,
do.
mhm.
I think the system creates challenges that are out of the control of you or I, that show up and impact how we access, how we experience healthcare. And I think sometimes, and I'm not saying it's easy, and I'm not saying that I
Yeah.
do it
Yeah.
all the time, but I think sometimes if we all just took a step back and said, where is this person I am currently interacting with coming from? And
Yeah.
what are some of the stressors that they're facing?
Yes.
Whether it's a
Yeah.
whether it's a stressor that just showed up that day, it's an ongoing chronic condition stressor, it's a
Yeah.
history of not being heard or respected, whatever it may be, if we actually tried to put ourselves in each other's shoes
Yeah.
and give each other grace, I think we'd all have better healthcare experience.
Yeah.
And
Yeah.
that works for
Yeah.
everyone. It works for clinicians, insurers,
Yes.
like,
Yeah.
everyone. If everyone came to it with more empathy and grace, I think
Yeah.
we'd see better
I
out.
always I always think it's like how much of the solution is just see the humans. Just see the
Mhm.
humans.
See the humans.
We're all
It
human.
is
See the
healthcare.
humans,
It is
right?
human.
Yeah, it's human. We're
Yes.
it was wonderful to have this conversation with you, Priya. I'm like, again, I have a million more questions. I feel like we could dig in even more. We're kind of almost at time because I was
Yeah.
trying to keep it to 45. We're over. But
Yeah.
whatever. So Priya is now on Substack with Women's Health Playbook, which I love how you teed up what's going to be showing up on Substack. So
Yes.
if you aren't already, go subscribe and follow and both and do the things. And then Women's Health Playbook is just where all podcasts are found, right?
Yes.
Is that what the people say? It's
Yes,
podcast. Go
you
through
can
all your
find
podcast streamings.
the first season, wherever you listen to podcasts, or as I like to say, wherever you podcast. So it's available. Just so you know, future episodes, we are going to
Yeah.
release 2 special episodes in August and September. And then the second season will be out in the fall shortly after those 2 episodes, and we will be
Is there
focused.
a theme? Yeah, for
Yes.
second season? Yeah.
We will be focusing on pregnancy, the decision, delivery, and beyond. So we're going to
Okay.
look at sort of the decisions that need to be navigated, the healthcare ramifications and costs associated with children,
Yeah.
how you make the decision that you want to have kids and you want to start this family, or do you want to
Yeah.
postpone it, and then everything through the entire pregnancy, to an episode on what happens after pregnancy and how does that
Yeah.
impact, how does it rewire your
Yeah.
thinking and your body,
Yeah. Yeah.
for the future. So we're going to be taking a holistic approach on it. We're still sort of nailing down the specific episodes and the speakers, but I'm really excited about it. I think
Yeah.
it'll open conversations that we haven't had
Yeah.
enough
And
of
it's the
around.
first clump on the map.
Yeah, well,
Yeah.
there's so much conversation now about
Yeah.
childbirth and decreasing birth rates, and,
Yeah.
like, how do we honestly open up that conversation and normalize what women who, can't or don't want to have kids experience as those
Yeah.
conversations are happening. And then we know women don't have the education they need to navigate the healthcare system when they're actually pregnant.
Yeah.
So I think it'll answer a lot of questions that
Yeah. Yeah.
women have or feel like they haven't been given the toolkit for.
Awesome. Well, I'm excited for the special episode release, and
Yeah.
then we'll look forward to the second season. And welcome to Substack.
Thank
Yay.
you, and thanks
I
for
didn't even know
working.
this was like a launch for this. This is
Yeah. Thank you so
so
much for having me and allowing me to talk about the Women's Health Playbook, and I hope, everyone found the conversation to be
yes.
productive or a nice way to spend a Friday afternoon, and I look forward to following along and continuing our conversation as we move forward.
Yes. Thank you so much, Priya. It was
Yeah,
so good
thanks
to
for
talk
calling.
with you. Okay. Bye
Bye.
everyone. Happy Friday.